Robots have become integral parts of many industries, and the medical field is no different. Robots have begun to assist doctors, nurses, and medical staff members to improve the efficiency and the environment of hospitals, and to save patients' lives. So let's explore how robots are transforming the medical landscape. Robots are everywhere. Nowadays, when you think of robots, you might think of ChatGPT or delivery robots scooting around town, but you might find them in a different place, the hospital. Medical robots have been a huge part of operations in hospitals for years, and now hospitals are rolling out brand new ways for robots to contribute to helping patients get better. So let's take a look at the ways that robots are making a difference in our healthcare systems around the world and actually saving lives. Medical professionals are highly trained, but they're still human. That means that even surgeons with years of education and medical practice under their belts might make errors. In the high-stakes environment of a hospital or operating room, this can mean the difference between life and death. In fact, more than 250,000 people die each year from medical errors. And using robots already helps bring these numbers down. Of course, we still need the bright minds of surgeons in the operating room, but robots can help give surgeons more control. Let's take a look at the Vinci surgical robot as an example. This multi-armed surgical robot is giving surgeons more precision and control during procedures. Armed with magnified 3D high-definition vision and controls that strap to a surgeon's wrist and hands, the Vinci makes small, precise incisions that are more consistent and exact than human hands. This helps both surgeons and patients. With the Da Vinci system, surgeons are able to maximize their chances of making an error during procedures, and surgeries are less invasive for patients since procedures are more precise. This means that patients can heal from their surgeries more quickly and get back on their feet. Hospitals are where people go to get better, but it can also make people sick. Hospital-acquired infections, also known as HAI, are a rampant issue, with about 1 in 31 patients in the United States becoming sick. For patients who are already immunocompromised, this could turn out to be deadly, and especially more so as antibacterial resistant infections become more prominent. Humans can only keep spaces so clean, so it's challenging to get hospital spaces where people literally go when they're sick to a point of 100% sterilization. But robots are changing the game when it comes to cleanliness in healthcare. Robots like the Xenex, a robot designed to keep the hospital environment stable for patients, are automated portable platforms that use pulsed full-spectrum UV rays to literally zap away infectious bacteria in used hospital rooms to prepare them for the next patient. It even helps kill the microorganisms that cause dangerous strains, such as methicillin-resistant staph, which is resistant to treatment once it's contracted. With robots, hospitals become cleaner, healthier environments than ever before, without requiring much effort from the hospital staff. Even though this might seem like a small role at a large institution filled with surgeons and doctors, maintaining a healthy environment can save lives. Cancer remains one of the leading causes of death across the world, and particularly in advanced economies like the United States. Billions of dollars have been donated to cancer research, but cures for many cancers remain elusive, making treatments the only option to save lives. The National Cancer Institute estimates that about 1 in 5 people will develop some form of cancer in their lifetime. So naturally, robots have answered the call to help treat cancer and do it better than we could before. One robot that's been around in the cancer fighting field for a while is the CyberKnife. It was originally invented in the 1990s and has since expanded to various hospitals across the United States. The name is a bit of a misnomer because the CyberKnife isn't a knife at all. Instead, it's a robot with a radiation source. It directs a targeted beam of radiation towards tumors. What makes it so different from ordinary radiation treatments is its movement abilities. It can maneuver quickly and target a tumor from different angles, all without having to adjust or move the patient. So, okay, it is like a virtual knife that can become physical when the radiation is concentrated at a particular physical location. It has some other perks as well, since it has so many capabilities when it comes to moving around. It can access hard to reach spots like tumors in the prostate, head, neck, and liver. And it can all be done without surgery, which used to be necessary for tumor removal in these areas. That means it's a less invasive procedure and helps to prevent healthy tissues from being damaged during the treatment process. Now, hospitals can be huge. Nurses and other staff members can get busy tending to patients and dealing with emergencies, especially when they're understaffed. Getting food and supplies to where it needs to be at any given time can be a logistical terror. Luckily, robots are helping with this. You've probably seen or heard of delivery robots for food and packages already on the city streets, and hospital transportation robots function much in the same way. For example, Tug, an autonomous mobile robot developed by Atheon Inc., carries supplies around hospitals, and they can carry heavy loads, carting around meals, linens, lab samples, waste, and other items. Tug is built with sensors, of course, to ensure that it doesn't run into obstacles or people in the hallways as it moves around the hospital. And it's also programmed with the hospital's floor plan to make it easier to navigate where they want to go to transport supplies. Tug robots even announce their presence in crowded hallways in order for people to move aside who may not be aware that the robot's actually behind them or in a place that they can't see. Having transportation robots in the hospital can be a game changer for overwhelmed medical staff members. It allows staff to focus on the most important thing, patient care, without having to run errands across the hospital all day long. After patients undergo traumatic injuries and operations, they have to recover. Some patients face a long road back to health, and others face the reality that their life may be changed forever by their illness or injury. Coping with these challenges can be tough, both physically and mentally. Now, you've probably heard of therapy dogs, but did you know that there's also therapy robots that hospitals and recovery centers are using to lift patients' spirits? PARO, the therapeutic robot, is one example of a robot making waves in this industry. Designed to look like a baby harbor seal, I guess because they're exceptionally cute. PARO provides an interactive experience for patients acting much like a therapy animal. PARO can respond to its name being called, it likes to be pet by patients, and leveraging AI develops a personality based on its memory of previous interactions and encounters with different patients. PARO aims to act quite a lot like a real animal. It even naps, blinks, and makes noises. Even though this robot might sound silly, and it might in fact act silly around you, therapy robots are increasingly relevant to the healthcare field as we place more emphasis on the importance of mental health. Therapy robots can help save their owners as they face the mental battles of illness and injury by reducing stress and anxiety levels. Now you're probably wondering, if we have dogs that can do this, why do we need robots? Using a robot does help the hospitals reduce the need of live animals. And while live animals are cute, trained therapy animals can be difficult to gain access to, and they can still be unpredictable. Furthermore, many patients are, let's remember, actually allergic to dogs or cats or other therapy animals, even some therapy donkeys that exist out there. Robots give medical centers a safe, reliable alternative. PARO has been found to be especially successful with elderly patients battling dementia, offering them long-term comfort as they face a terminal illness. Now, nursing can be an overwhelming job, but robots have been helping to combat the burnout in the field. One such robot is Moxi, a product of the company Diligent Healthcare, established in 2017. Moxi is an AI-equipped robot with modern sensors and cameras so that it can autonomously roam healthcare facilities. It can greet patients and engage in conversations. Though it doesn't complete patient-facing medical tasks, it can help with tasks like collecting used linens and cleaning and delivering lab specimens. What sets Moxi apart is its social awareness and intelligence. Because of its AI integrations, Moxi could help pave the way for the future of what robots look like in the medical field long-term. Robots can also bring much-needed muscle to hospitals as they assist with nursing and physical therapy. Engineers at Riken and Sumitomo Riko Labs in Japan have developed a robot nurse bear designed specifically for this task. The robot nurse bear can lift patients either from a standing position or from the floor, transfer a patient to a wheelchair, carry a patient to a different location, or turn a patient in bed. These robots are especially helpful when working with elderly patients or those undergoing physical therapy. As we look towards the future of robots in the medical field, what might it really look like? Currently, robots work mainly as assistants. They don't give out medical information or diagnosis, instead focusing on improving the efficiency of medical institutions and maintaining the environment. However, as we've already seen them helping to save lives, and as AI advances and robots become more advanced as well, we see them starting to work in more patient-facing medical roles, or will they primarily stay in the background? Let us know in the comments what you think. Would you be okay with a medical doctor that you interact with when you go to your doctor's office, that gives you a diagnosis, tells you what's wrong with you, sends you on your way, never talk to a human doctor again?